Hi everyone, I'm Laura Forbes. I'm the Communications Director for the Greater Indiana chapter of the Alzheimer's Association. I'm at the Indiana State House today with our Director of Public Policy, Jason Barrett, as well as Representative Gregory Porter of Indianapolis. And we're here to talk about the role that public policy plays in the fight against Alzheimer's disease. And Jason, I want to start with you. I know that most people out there, when they think of the Alzheimer's Association, they think of the Walk to End Alzheimer's, they think of our services, but they don't necessarily think about public policy. Why is that such an important role, and what does that really look like?
Sure, thank you. So the mission statement of the Alzheimer's Association, it begins with the phrase to eliminate Alzheimer's disease. And the way we're ultimately going to do that is through research. We need a medical intervention, and that's going to come about through research funding. And currently, the US government and the Chinese government are the top two funders of Alzheimer's disease research, and the Alzheimer's Association is third. So when people attend a Walk to End Alzheimer's or donate money to the association, part of that goes into our research funding, but we need to make sure that we advocate at the federal level and at state levels as well here in the US to encourage legislators to increase the amount of research funding for Alzheimer's disease, be it at the NIH or at the state government level. So we have been advocating at the federal level for quite a while now, very successfully. We've quintupled the federal research dollars for Alzheimer's disease at NIH and had other landmark bills passed as well. And lately we've also been able to shift our focus onto the state government world so we can, through Medicaid and other factors, we can play into those to assist with the care and support at the state level for those living with Alzheimer's disease, their caregivers, and others who are affected by the disease. So with the Alzheimer's Association here in Indiana, we are just now ramping up our state policy efforts through advocacy, through volunteer efforts. And last year we introduced our first ever bill into the Indiana State Legislature, and it was to create an Alzheimer's State Council that would focus on analyzing where Indiana lies in certain areas and aspects of disease care and support, and then identifying recommendations for those. And it was actually Representative Greg Porter who was kind enough to introduce that bill to us. And a quick story I want to share is how I ended up meeting with Representative Porter. I was at a legislative breakfast, and Representative Porter was speaking at that. After the event, I went up and introduced myself and said that I was with the Alzheimer's Association. And the words he said to me, it was, "Thank you for doing God's work." And at first, I didn't really think of the impact of that statement. But later on, I was at home, I was looking over notes from the day, and I really thought about how impactful that was, how powerful that was. And when we're looking for somebody to help carry our bill and introduce that and champion legislation for the association, we want someone who's passionate about the cause, somebody who cares and understands this. And Representative Porter, I just want to ask, if you don't mind, you also shared with me that day a personal connection you have to the disease. And if you don't mind, could you tell us a little bit about your connection and why you are so anxious to move forward with our bill?
Well, thank you both for being here at your State House, and it's a pleasure to be with you, to have this real conversation about this disease and what it does to not only to individuals but to families and extended families within the state and United States of America. Well, my mom, who's 90 years old now, who was at one point, as we all have, our parents were super vibrant, independent, do what they want to do, and even at my age still tells me what to do. It has dementia and Alzheimer's. And I live with it every day. It's my daughter says, my family, we're both only children. We say it's the new normal. And with my mom having this disease, and some days it's good, some days it aren't. I just understand that you look and you look into their eyes and you listen to them and you try to look at those complex sentences and put them back together, so you can understand what they're really saying, because they really feel that they are moving in that direction. They know what they're saying, but you just gotta help. You got disaggregate the language sometimes, and that's the reason why we're there. And being involved throughout this community and being in the healthcare arena, also not only here in Indiana but nationally. This is something that particularly the National Black Caucus state legislators are very involved with, because this disease hits African Americans a little bit higher than other individuals. So it's something that we as a culture we need to address, and we want to look at the resources to address our needs of those various communities.
Yeah, absolutely. And thank you for sharing your story. I know so many people, watching really understand, just what you're talking about. And I think, so many people have gone through this or are going through that. We hear that every day in our work. So there is very much a human cost to this disease, but there's also a real cost to the state. Can you talk a little bit about that cost as well? Representative Porter, we'll start with you.
Well, yeah, the cost, it's over $1 billion right now, a cost to our state. And I think that cost is there. We have 110,000 people right now in Indiana that has Alzheimer's, but I think more important is probably over 300 to 400,000 people that are affected by it because of what it does to one individual. And that resonates to billions of dollars. My colleagues talk all the time about what does the data say, and what's the fiscal impact of this. And that's very important because the real fiscal impact is $1 billion. How many people it affects, and my colleagues are very interested in me, because unless they really understand it or hits close to them, to us, we don't pick up on it. And that's very unfortunate. Our bill that we had, 1351, was a piece of legislation that we had bipartisan work with it. We had Representative Shackelford, Representative Bacon, and the chair of the health committee, Kirchhoff. So, so when all that happened, we were very important. We understand how important it was for this to hit us. And so you ask about the fiscal, we understand the fiscal part of it and putting it together.
Yeah.
And with that, when you mentioned the $1 billion, that's just out of the Medicaid expenses associated with care for Alzheimer's disease. What that really doesn't take into account as well, you mentioned 300 to 400,000 people providing unpaid caregiving duties.
Yes.
A lot of times a spouse, a child, sometimes a loved one, a family member. Those people providing caregiving duties, they are sometimes forced to reduce their hours at work or even leave the workforce altogether to provide that care. And not only that, they have that reduction in income, they may have increased stress from this disease. Caregivers have of somebody with Alzheimer's or dementia have about a 50% increase in their own healthcare costs after they begin the caregiving duties because of the stress associated with it. So this disease, it really is a public health crisis nationwide, especially here in Indiana. Because even if you are not living with Alzheimer's, if you're not somebody providing unpaid caregiving duties, if you're not affected by this with a family member or a close friend, if you pay taxes, you're affected by this disease because it's the costliest disease in the state of Indiana right now.
It is. And to switch back to a personal, like my daughter is with my mom now, so she's moved back and she's living with her, so she's there. So my mom had 24-hour care. And that takes away from, a young person's lifestyle or what he or she's going to do. And my mom has these little things, and we have to grab her and hold her up if she goes down. So, I tweaks our backs and things like that. So it is. People don't really understand the unintended consequences of this disease and what it means to us physically. But like we said, it's a new normal. We grin it, we bear it, and we go and deal with it because this is our mother and grandmother.
Yeah,
Exactly.
absolutely.
Yeah, that's it.
Yeah. So what can the state do to better support those caregivers?
Well, I think from our perspective, we wanted to create a council to talk about it. Now, I know back in, just you may want to hit on this because you know more. You can give the 10,000 level perspective of it. But what we with 1351 was to create a commission, go through and analyze what the impact of the disease is to our community, and don't kind of put it together real slowly and be thorough. So many times we do things with a knee-jerk reaction. But one other thing, as I tell people, Indiana, we're not slow, we're just thorough, and sometimes we're too thorough. And I think our bill was looking at 2021 to begin to really have this commission, this council with the Indiana State Department of Health. So, Michigan has just did theirs, that they have a council, about 21, 22 people. I think a council that we looked at is running about that same range. So, the whole point is that we're not really reinventing the wheel. We're just grabbing what's out there. And we have our neighbor in Michigan has it, and it's right across the border, so we should be able to address that. So the impact is tremendous for us. And as we revert dollars back to the state of Indiana, we have maybe a 1.9 to $2 billion surplus. We can look at a few dollars, $300 or $400 million to address this issue.
Yeah.
Some of the hurdles that we see when we say we want to form a council or whatever the proposed legislation may be, it's to identify where Indiana currently sits in terms of care and support and diagnosis of the disease, and then make recommendations. How can we improve these? Some of the hurdles we see are there's no cure for Alzheimer's disease. It's the 6th leading cause of death here in the state of Indiana, as well as nationwide. There's no cure for it. There's no medical intervention in terms of ways to prevent or slow down the disease. And so people say, well, what can we do? How can we spend money to either increase the care and support or even offset the costs of the disease? And really the way that those cost savings come in is through promoting early detection, diagnosis, awareness of the disease, increased care planning, so families understand what they're going to face with the diagnosis of Alzheimer's disease. What is it going to look like 1, 3, 5 years down the road? How do we get a financial plan in place? These are things that put the family in a better position so they are prepared, they have less stress, less worry, but that also helps them to understand what's coming. You avoid unnecessary hospital and ER visits. You have a lot of cost savings built into these measures, as well as increased care and quality of life. So that's really what we want to see in Indiana, is just ways that we can identify steps to move forward and just to take those gradual steps to increase the way that we approach this disease.
Yeah, and I know the Indiana Division of Aging recently created a new Dementia Care Advisory Group. Tell us about what that group is looking to achieve.
Right, so this is through a grant, through ACL grant, and what this is going to do, or it may be through a grant. We're in the process right now where I got an update yesterday on this group. It's basically a group that FSSA put together, and they're convening about 10 to 20 individuals right now, still building that group, and looking at how we can make Indiana more dementia friendly. So we're identifying some of the biggest hurdles and ways that we can go about rectifying those or moving forward and into baby steps to maybe chip down some of the bigger hurdles related to this disease. Right now it's going to focus a lot on caregiver support, which is very important, especially with what you mentioned earlier. But this group, we've only had our introductory meeting, and the FSSA Division of Aging right now is looking at potentially seeking federal funds through a grant to help move this initiative forward. So it's a bright light that we have, but it's still very early to see what this may become or what this may turn into. So I'll keep you updated.
Okay.
I think that's very important. Just you mentioned the word, the bright light. And we just have to shine a light on this disease and what the impact is. And believe me, I mean, when we introduced the legislation this past year, I worked it, and we worked it over the summer, and we didn't really get far with it. We tried to get it into a summer study committee. Didn't get there. But we have to persevere. We have to stay persistent and continue to calculate how we can get this conversation going a little more broad. And sometimes it takes 2 or 3 years, but I've been around for a while, so I'm kind of impatient. I'm getting too old, and my grandmother had this, my mother has it, so I'm trying to address it before I get it.
Yeah, I think a lot of people who are watching feel that same sense of urgency, and I guess my last question would be, what can people do to help advocate for these steps that need to be taken at the state level?
One thing is call the Speaker of the House and let Speaker Bosman know how important this is, because no matter if you have the committee chairs, believe me, he does drive the agenda. You call the governor. He's the CEO of the state. Let him and call Lieutenant Governor She knows Suzanne Crouch, Governor Suzanne Crouch. She knows she has influence. And just call your individual legislator. And then what I encourage people to do is call people in other parts of the state to call their legislators. Sometimes, I may get 30 or 40 calls, and one of the things that we look at is say, are they my constituents? Even though we do vote, and every vote we take it impacts 6 million people, but we have a little more level of urgency when it's our constituency that's within the district that we is one of those 62,000 people. So what people have to do is create a chain to call someone else, to call their individual legislator within that district.
Yeah, makes sense. And like you said, this is a bipartisan issue.
This
affects everyone, and so it doesn't matter. We say red and blue makes purple. It doesn't matter. What party you're calling. You make those calls, make your voice heard.
Exactly.
Jason.
And raising awareness with the state government is, whether it's an agency, the governor, lieutenant governor, the Senate, the House, that's really where we're going to make that progress on identifying this as a public health issue here in Indiana. Raise awareness. A lot of people may not be aware of the $1 billion Medicaid cost. They may not be aware it's the 6th leading cause of death. And there are ways to intervene without having a medical intervention at this time. So just identifying that is a real issue, raising that awareness. But if people want to get involved through the Alzheimer's Association, if this is something that you want to be advocating for, you can go to alzimpact.org/volunteer, and that's where you can learn more about the advocacy volunteer opportunities we have. And if advocacy volunteering isn't your thing, but you still are passionate about the cause, I encourage people to attend a Walk to End Alzheimer's event in their area. You can go to alz.org/walk and find where all the walks are throughout the state of Indiana, and you can take part, start a team, raise funds, and then join an event where there's hundreds, sometimes thousands of like-minded people who are all passionate about this cause. So there are a lot of ways to get involved.
Absolutely. We all have a role to play in
Yes,
it.
we do.
Yeah. Thank you so much for being here. We really appreciate it. And thank you all for watching. We'll see you next time.